Hello, everyone, and welcome to PAPERI Bright Minds Series, organized by the Pan-African PGS Education and Research Initiative. My name is Haggai from Tanzania, and I will be your moderator for today's session. On behalf of our founder and chair, Dr. Farhat HACHED, and the entire PAPERI team, we are delighted to have you with us as we celebrate International Women's Day and honor outstanding women leaders in genetics and genomics. This session is dedicated to recognizing excellence, leadership, and impact, to inspiring the next generation across Africa and beyond. Today, we are so privileged to welcome our distinguished guest, Dr. and Professor Dorra H'mida. Dr. Dorra is a professor in medical genetics and histology-embryology at Farhat HACHED University Hospital in Sousse, a dual alumni of Faculty of Medicine in Sousse and the IGBMC in Strasbourg. She brings extensive international expertise to her roles as founding president of the Tunisian Society of Human Genomics and lead in molecular genetic units. In addition to her clinical roles and leadership roles, Dr. H'mida has been a national coordinator for the Orphanet Rare Disease Portal since 2014. Her research portfolio, spanning over 2 decades, is dedicated to understanding congenital disorders and mental retardation. Currently, her lab focuses on the complex genetics and epigenetic mechanism driving intellectual deficiency and cancer. We're truly honored to have Dr. and Professor Dorra H'mida here with us today. Professor Dorra H'mida, we are very much honored to have you here. Welcome and thank you for joining us.
Thank you so much, Dr. Haggai, for such a gracious introduction. I'm delighted to be with you today.
You're welcome. We'll begin with a conversation about your professional journey, followed by your research and leadership vision and future. Let us begin. Could you share with us into medical genetics, what motivated you to pursue this specialty?
Actually, my journey is defined by a scientific paradox. I trained in Africa, in Tunisia, in Sousse city, and also in Europe, in France, in Strasbourg, as you mentioned, in the IGBMC Institute. And while Europe gave me technical key, and at that time, 20 years ago, cutting edge SNP arrays, it was Africa and Tunisia particularly that showed me the African doors those keys need to open. So I pursued genetics because I realized that our Tunisian patients deserves local cutting edge medicine, yet we were relying on Western providers to address our medical issues. This did not fit with our patients' phenotype, genotype, and clinician needs. So I was motivated actually to move from my MD status I had in Tunisia to PhD status I get in France, because it is still a tradition in our team, a 40 years tradition, our team, to have both MD and PhD. And I wanted to be more than a clinician, more than a medical doctor. I wanted to be kind of translator of our own biological history, if I can say.
Well, that's good. And how did your training in Sousse and Strasbourg shape your scientific perspective?
My dual training, let's say in Tunisia and in France, actually Tunisia gave me the human pulse, the clinical reality of rare disease in Africa and in North Africa. And my time in Strasbourg, 4 years of training, 4 years and a half, was a scientific awakening, technology, both for technologies and protocols also. but the spark was actually a realization of a profound inequity. I was working at that time, 20 years ago, with, as I told you, with cutting-edge technology, cutting-edge SNP array, to identify new genes for recessive ataxia. At that time, there was no next generation sequencing, but let's say the next generation sequencing was at its first beginnings. And I realized that while the technology was from the Western continents, from Europe and American continent, the patients and the patient I was dealing with and all the team was dealing with were African, were North African. So the genetic richness, let's say, being studied often came from our own North African, own African population. So once back to to Tunisia, I realized, sorry. So once back to Tunisia, I realized we were using wrong keys. If I can come back to keys metaphor, or let's call them inadequate keys for both clinical phenotyping, genetic counseling, and also for the interpretation of our genomic data, of our African genomic data. And I think all my colleagues agree, if we use the Western strategies and recommendation in our African context, you'll very rapidly understand and realize that you are not using the right language with your patient, even for genetic counseling, not the right phenotyping tools, which is actually essential for patient follow-up.
Yeah. And if you can recall, what are some key milestones that really defined your career?
To define my career, I can say that the first key milestone is transitioning from MD to PhD. It was, as I mentioned, it is a 40-year tradition within our medical team, this transition. And this transition from MD to PhD has been a defining milestone in my career. This dual expertise, let me say, has allowed me to serve as a bridge, collaborating closely with genetic medical doctor, clinical geneticists, medical researchers, as well as PhD scientists. I feel like it is, and it is, I think, it's not just a feeling, it's a reality. This dual perspective has been instrumental in opening my path to multidisciplinary innovation, allowing to view complex challenges through both clinical and scientific lens. And this is precisely what defines the leadership I have now at the TSIG, I think.
Yeah, speaking about leadership and institutional development, what really inspired you to found the Tunisian Society of Human Genomics and Genetics?
The Tunisian Society is a young society. It was founded in 2 years and a half ago, 2024 at the beginning, February 2024. I founded the Tunisian Society with a group of colleagues, genomic researchers, data scientists, and medical genetics from 12 medical and research institutions all over Tunisia, from north to south. So it wasn't just a professional milestone. This is, I think this is a founding group feeling. It was an act of scientific decolonization. Actually, we all needed a table where Tunisian scientists weren't just guests, but hosts. It was really important for us.
Well, and how has the Tunisian Society contributed to strengthening genomic medicine in Tunisia? And if you can just explain what are the main challenges that are being faced in the genomic services in Tunisia and in Africa at large.
Yes, as you may know, the Tunisian society, like any other association, we call it society, but it is actually an association, of course, has created a bridge between uh, genomic field, let me say, and the decision maker, as well as civil society, of course. And one of our main goals is to democratize access to genomic knowledge. We are committed not to do only science. We are, of course, doing science, but not only. We are building the ecosystem for genomic medicine in Africa and in Tunisia, especially. Um, you asked me about the challenges, isn't it?
Yes, yes. What are the main challenges?
Yeah, definitely the biggest challenge um, for sustainable genomic service in Africa and even in Tunisia, of course, is the brain drain, I think. As you know, Africa is the youngest continent in age, with the mean age of 19 years. We have this demographic power, but we lack the sustainable infrastructure to keep our best minds. And leadership is about building this magnetic environment here in our home countries and home continent.
Thank you. And looking into the clinical genetics and rare diseases, as the National Coordinator of the Orphanet, can you maybe tell us a little bit about the Orphanet and how have you advanced, uh, how has the Orphanet helped in advancing rare disease and care awareness?
Mm, uh, Actually, it's not that simple. While I hold the role of National Orphanet Coordinator in Tunisia, my primary focus and what truly drives my work is my identity as clinical and medical geneticist. When we talk about orphanet, we talk about orphan and rare disease, and we deal with the urgency, we deal with the now. Families waiting for a name for their child suffering. It is actually very frustrating for a family with a rare disease not to have a name for their child disease, and the diagnosis is a real relief for them. It represents the first step for the family towards dignity, and this is really a fuel for us. So we have worked to end this diagnosis odyssey. We are doing our best to turn the rare into public health priority in Tunisia and I hope in Africa also, in all Africa. And we are also working to direct the eyes of the decision makers to rare disease, uh, making the invisible visible, let's say.
Yes. And while working with the orphanet, uh, did you come up and find gaps in diagnosis and managing the rare disease, rare genetic conditions and disorders in Africa?
Yeah, of course. Well, it is a common misconception that the gap is purely technological. In reality, the most significant barrier are genomic literacy among clinicians and the critical life reference data in Africa, but also the low level of population awareness and the lack of health policies. We mainly need clinicians to understand genetic. It's not the future, it's now. Many of them aren't trained to see the genetic data, genetic signals. I strongly believe that scientific progress cannot wait for administrative alignment and wait for decision makers to make to bridge the gap. We have to do it by ourselves.
Exactly. And maybe you could give us your insights about how genomic tools can be used to improve patient outcomes in low resource settings,
Sorry?
especially in Africa. Like maybe you could give us your insights on how genomic tools could be used to improve patient outcomes in low resource settings, especially in Africa.
Okay. Um, Actually, it's very challenging, especially because the volume of patients is growing faster than the number of doctors. I believe that only AI can bridge this gap. We must move on the wave of AI. AI must be taken as our ally. It acts as a force multiplier where genesis are few, especially in Africa. And with the median age, as I told you, of 19 in Africa, we all agree, I think, that this young tech native population, I'm sure you belong to this tech native population, is ready for the AI revolution in healthcare.
Yes. And in your research and scientific contributions, Professor Dora, your research spans in congenital disorders, intellectual disabilities, and cancers. What really drives this focus into these areas?
My research focus. The answer is I must start with my mission. I'm here to serve the urgent demands of my patients and the critical needs of my clinical colleagues. In Tunisia, the most frequent reasons for consultation in medical genetic department beyond oncology are intellectual disabilities and congenital disorders. And this is not just my own medical observation, it is a Tunisian demographic reality. By 2026, Tunisia has reached a mean age above African mean age of 34, with a life expectancy of 77 years. And we are actually a mature population that has successfully moved past the era of infectious disease. Today, we face a second transition in Tunisia. We face the explosion of non-communicable and chronic genetic disease. And this is why we must ensure that our diagnostic speed matches our demographic evolution.
Yes, Professor Dora. And if I may ask, what are the most promising developments in genetics and epigenetics research today, according to your view?
Genetics and epigenetics.
Yes.
Um,
What are,
you are touching a subject very close to my heart. To me, the most promising frontier is the study of epigenetic and molecular scars. Global research work are investigating how the successive historical traumas Africa has endured, colonization, starvation, exodus, have physically altered our gene expression. It is very important, I think, to be aware that these traumas aren't just history, they are written in our epigenetics. And I believe that here is the bridge to genomics. This allows us to move from this biological destiny to clinical possibility. And epigenetic give us, offer us, it's not a personalized medicine, but let's call it a personalized prevention that finally acknowledges the full history of the African genome.
thank you. And as an expert in this field, what do you think, like, how can African laboratories strengthen their research capacity and global visibility, especially in this area of genetics, epigenetics?
How to strengthen the research capacity and global visibility. Let me give you one thing not to do, but not something to do. what is not to do is, sorry if I don't answer exactly your question.
It's all right. It's all right.
So one thing not to do, we don't need to copy the West, definitely. We need to lead in the area they cannot. Our own unique population structure and specificity, our cultural, our social, environmental, and history. And once we succeed to do that and to change our mindset, African labs will be seen when we stop exporting samples and start exporting insight based on our unique genetic heterogeneity.
Exactly. That's a very powerful insight. And maybe if we can just expand a little bit more on that, can you share like how can we start from what you just said, like the points not to do, like not copying?
Not copy. It's really, actually it's very simple. We were trained to copy the West ideas, the West projects, but of course we can align to the trends, if we can call them trends, but we have to focus on our specificities. I've just talked about epigenetics, and we have a specific and very particular history in Africa. We have a very particular, very particular culture, and very heterogeneous culture, very heterogeneous history. I'm sure this contributes, and there is a lot of research work that focus on that. This contributes to our genetic diversity. Work from the H3 consortium, specific research within African context that demonstrates how our environment history has literally programmed key genes, especially genes um, of immune system and metabolism, um, that were the gene expression was related to the exposure of starvation of external environment. So we have so many specificities. We have to focus on them and to do something different from what is done in the West continents.
Thank you so much, Professor Dora. Point taken. And as a woman in science, and leadership, um, actually right now there's so limited number of women in genetics and genomics, and they're trying to come up. But as one, would you tell us what challenges you have had to face during your journey?
Oh, so many. um, Let me give you one or maybe two I'm facing in my everyday professional life. And I'm sure I'm not the only woman facing those challenges. The first one is the likability trap. As a woman leader, you are often punished for having the high standards required for world-class science. And also, as a woman leader, you are often expected to be either the expert or the leader, but rarely both with authority. It is accepted for men, but not for women. I'm sure things will change very rapidly, but we are still here. So what would be the solution? Maybe let me be optimistic with the challenges and some solutions. One solution, I think, a lot of women leaders agree about this solution is developing what they call it the leadership muscle, the woman leadership muscle, which is the strategic defiance, knowing when to break protocols, to build progress, and when a protocol does not work, you just change it and move to another one. I think the challenges are really so many, but mm, these are the most important one I'm facing.
Thank you. And do you think that academic institution can play a role in supporting women and women scientists and clinicians?
Academic institutions actually have more women scientists than men, especially in North Africa and in Tunisia. But what they can do, maybe they do not really have the choice because there is a lot of women, but institution must provide besides mentorship, they must provide sponsorship. We need women in control of budgets and of genomic labs, especially for genomics.
Yes. And you shared with us some struggles that you have had to face and the ones that you're currently facing. And could you please share with us what strategies have helped you succeed in leadership and your research roles?
I think I already gave you the strategy. It was just after the challenges. It is the muscle I developed and a lot of women leaders develop is the strategic defiance. If the protocol doesn't allow for progress, build a new protocol, just do that. And don't stick to known paths, don't stick to Western paths, innovate. We don't just follow protocols. We the future. We must define the future of Tunisia and the Tunisian context by creating our own future.
And you spoke something about mentorship. Um, why do you think mentorship is essential for young genetists and clinical scientists?
Um, yeah, I mentioned mentorship, a very sensitive aspect. It is because let me call it the hidden curriculum. It isn't in any textbook. This set of unwritten rules, cultural codes, networks of influence, and social norms that must be mastered to succeed, yet are never formally taught.
Yeah,
And we lack of mentorship, and particularly for women in Africa.
exactly. I like what you said about mentorship is a hidden curriculum. I think that could be a definition.
Yeah.
Yeah. So, how do you approach mentoring the next generation?
Oh, I would say I mentor with honesty. My students and fellow would say I mentor with brutal honesty. I tell them the world wants your data, and we are all facing that. But it doesn't want your leadership. So you must take both data and leadership. Fight for that.
Wow. Thank you for that insight. And what advice would you give to the young women entering the medical research career?
Women entering medical research career, so many advices not to make mistakes I made and other colleagues made but maybe one advice would be, or two advices, dream, be an architect, but you keep your clinical, especially for medical researcher, keep your clinical empathy as your compass, I think, and also be the bridge between in this era of AI, be the bridge between the digital and the human, master both AI and the clinics.
Exactly. I agree with you that it's inevitable to use AI in this world
Yeah.
today. Yeah. So speaking about genomics and genetics, um, I understand that there's an ethical part of it. And what can you really say? What are the ethical issues that are mostly critical in genomic medicine today?
Um, yeah, if you would like, we decide to adopt AI and take it as an ally. The most critical issue is our sovereignty. If you use AI models trained on Western data to treat Tunisian and African patients, we are committing a new form of genomic colonization. So I think this is the most critical issue.
Wow. And how can we ensure equitable access to genetic services in Africa?
Oh, equity. Equity isn't just giving everyone a test, every patient a test, every citizen a test. It's ensuring the patient, the family, and the population awareness, and above all, the interpretation of that test is accurate for an African genome. Equity means that the Tunisian, the African patient, whose data contributed to a breakthrough in genomic medicine, must have first row access to that medicine.
Yes, thank you.
But
You've
it's very
spoken,
challenging.
yeah, that is very true. You've spoken about ethics and equity, and maybe I would like to ask you, what role should clinicians and scientists play in shaping their health policy?
The role in shaping health policy, scientists must be the guardians of the data. And keep in mind that scale up, technology scale ups, without ethics up is very dangerous. We must influence laws to ensure African genomic data isn't exploited by global entities without benefit sharing. Like I said, we must have first row access to that medicine.
Yes. And you've spoken something sensitive about genomic colonization. Maybe I'll just like to ask you, like, how can we start moving away from that, like generally in Africa, not just in Tunisia, because I understand that many countries right now we are using genomic data sets from that are
We
not
must
related to
influence
Africa.
laws. We must ask for our share at the table. We need very strict sociogenomic guardrails to ensure that genetic information is never used to further marginalize vulnerable groups, especially in our continent, where there is so many vulnerable groups. And it's a continuous fight, let's say. It will never end, but we have to be really very good guardians of our data.
Yes, thank you very much. And speaking about vision for African genomics, how do you envision the future of medical genetics in Africa? Your perspective.
Mm. I envision Africa as a global hub for genomic medicine because we have the most genetic diversity, and the world will eventually have to come to us to understand the limits of human biology. Um, this is how I see things.
That is very true. And what do you think? What role can regional collaboration play in advancing genomic medicine?
But initiative like PAPERI are the blueprint. We must pool our data across borders to create genomic kind of collaborative kind of genomic United States of Africa.
Yes. So this invites multiple organizations to collaborate to yes, to advance genomic medicine in Africa. Yes. What messages would you like to share with the young women and international on the International Women's Day?
Young women, both in research and outside research. Young African women, let me address a message to young African women. I would say reclaim your narrative. It was written in your genes, but your future is written in how you express them. And
yes.
Just to remind them of epigenetics.
Yes, thank you. And as we're approaching to the end, what legacy do you hope to leave in African medical genetics?
I want to leave behind a generation of Tunisian African women who don't feel they have to leave their home country to be world class. And for my patients, I want to live in Tunisia and the continent where no patient remained undiagnosed because of the lack of local expertise. It is really crucial for us, for our independency.
Wow, that's something big. Hopefully, you'll go through to accomplishing it. Yes. So, what really keeps you motivated after more than 2 decades in research and clinical work? What is really keeping you up to pursue all these and the legacy that you want to leave in Africa?
After 20 years, the same feeling, the same motivation. It is the spark of discovery, of a successful experiment, and genetic analysis in the student eyes. I think in my eyes and in my student eyes. And to come back to my patients, it's also the relief of a family, of parents, of a mother voice when she finally has an answer for her child. I think this is the only fuel I needed to keep myself motivated.
Thank you, Professor Dora. And as we're approaching to closing, do you have anything to say to PAPERI, as in anything concerning to genomic and genetic advancement in Africa?
Oh, a lot of things. Maybe I have something to say to young researchers listening to us. I would like to thank them for their interest. So Africa is no longer the silent passenger of genomic revolution. I think now it's obvious. And Africa's genomic revolution will not happen without you. So claim your seat at the table. Africa's genomic revolution is now. Join our society, join the Tunisian society, engage with orphanets all over the world, and move from being a spectator to an architect for our scientific sovereignty.
Thank you so much. Professor Dorra H'mida, thank you once again so much for sharing your inspiring journey, insights, wisdom with us today. Your dedication to science and leadership and mentorship is truly motivating. And we are confident that your story will encourage many young women and scientists across Africa and beyond to pursue their dreams with confidence and purpose. On behalf of PAPERI, we sincerely thank you for your time to be part of this special International Women's Celebration. Thank you so much.
Thank you so much, Dr. Hagai. It has been a privilege.